what Crohn's disease is in layman's terms.
The Crohn's disease is a chronic relapsing inflammation. So the difference between inflammation and infection is there's something identifiable, like E. coli, bacteria, or virus. So we've not been able to identify a microbial source. Infections are usually self-limiting. They happen from anywhere 3 days to 2 weeks. This is a chronic relapsing infection, inflammation, which is not an infection of the intestine.
How old are you?
46. Today I feel 50. And then some. I think that's the whole funny thing about everything, right? It's like I don't ever feel that old, except when I wake up in the morning and I'm, sick. This morning was bad, dude. Like my hands, my arms, like filling up, and it's just fucking the pain. Just like I literally woke up like like groaning like the hunchback or something.
The most common site is where the colon and the small intestine meet.
The cecum, correct?
It's the cecum and the ileocecal valve. That's where the appendix is.
Mm-hmm.
Most common ways people used to present, their doctors thought there was appendicitis. They take the patients to the operating room and they open it up. The appendix is normal, but right next to the appendix is the severely inflamed ileum.
Mm-hmm. And
there are 3 types of Crohn's disease. So first I told you it can occur anywhere. It can occur in both males and females. It occurs in every community: whites, blacks, Hispanics, Latinos, Asians, everybody has it. It's a devastating disease because it does 3 things. One is that it can cause chronic inflammation. Inflammation can then result in blood loss, anemia, weight loss. Second type of Crohn's disease is something that punctures or penetrates, which causes fistulas, abscess, is free perforation of the bowels, where the gut contents will start spilling in. And the third type is where it narrows down and shuts it, and you get a block, and that almost always requires surgery. So those are the 3 types of Crohn's disease you get.
And my disease falls under...
Almost everybody has an inflammation, but your main disease is penetrating, fistulizing Crohn's disease because you have perianal disease with abscesses and fistulas.
Right. And I've had 2 major resections.
So you have you have the most common Crohn's disease that requires a lot of lifelong treatment. Your disease is where I just told you in the cecum appendix area, so you've had surgery. Those patients can have isolated disease there, or they can have perianal disease where they get fissures and fistulas around the rectal area.
Humans are very, very strong. Remarkably strong. But this is the last place I think anybody wants to be. Nobody wants to be. I'm gonna have to make more of a conscious effort. I just signed up to go. I told you to go back to the boxing gym and found out the yoga's full up the street. The cigarettes and the booze, man. That's it. It's a wrap. It's a weird reality check. I go out and have a glass of wine and a scotch once in a while, but I can't act like I used to when I was a chef, and young.